Oh yeah, yeah, no question about it. And again, it gets into the grade. We grade fractures based on the severity of the open wound. A little poke hole is much less likely to be infected than a motorcycle accident where your leg is wide open. So it goes on the degree of how open the wound is and also how much soft tissue is missing or stripped off. So you could have a very large skin incision, but the muscle and the deep tissue, the periosteum, is intact with a small type of a fracture. Those actually, even though the wound is very big, the muscle and the soft tissues that provide the blood supply are still viable and won't turn a hair. On the other hand, you can have a small laceration with deep, like an impalement type wound that destroys muscle and deep soft tissue where there's no healthy tissue around the fracture. Those are very prone to infection because of the lack of healthy blood supply. It all comes down to how much blood supply or the tissue that provides the blood supply is available to help you. So closed fracture, usually the soft tissue is contused, it's bruised, but it's not missing or it's not shredded apart. So those, a reasonable infection rate for a closed fracture, let's say an ankle fracture that you fix, is probably less than 1% infection rate in a clean surgical environment. Should be actually less than 1% for a closed, clean surgery. For a grade 3, a really bad open tibia, where there's a lot of muscle devitalization and in some instances where you've maybe torn the artery, they can be as high as 25, 26%. So depending on the amount of soft tissue damage, that really is what determines how bad they become infected or if they will become infected. So it's not necessarily the bone, how bad the bone is broke, it's the surrounding soft tissue envelope that's really the key as to the genesis of infection and how you treat it.